Hi everyone, good morning. Welcome to Nostella's Corner. Let's discuss briefly about meningitis. What do we know about meningitis? What do you call meningitis? What is meningitis all about? Remember, we are going into the next season. The weather is changing gradually, and the environment will be filled with heat. The weather will be hot, and everywhere will be very, very hot during Harmattan or during dry season. And meningitis is always common during that season because one, you don't open your room to ventilation, the windows are always closed. You find out you have a lot of people in a room, and there is no cross ventilation. The room is not well ventilated. You notice this time, that is when meningitis is common. And for those that have not been vaccinated, please, during this time, once they announce take vaccines for meningitis, please go and take it if you've not taken it before. And remember to always vaccinate your children during that time. And apart from that, during their birth, they have stages of their vaccination. When it gets to that stage, please kindly give them the meningitis vaccine. Don't skip any of your vaccination. Very, very important. So what do we mean by meningitis? We say meningitis is an inflammation of meninges, meaning the inflammation of the membrane surrounding the brain and also the spinal cord. When it gets infected or when anything is wrong with it, it reacts. And what are the causes? It might be viral infection, it might be bacterial infection, it might be due to fungal infection or rare parasite. Meningitis always starts with any of this. It's either is virus caused, it's bacteria caused, it's fungal, or any rare parasite affects the meninges of the brain and the spinal cord. So what do you think you can do? What are the symptoms? What do you feel when you have meningitis? You notice the fever is of high grade above 37.5, 40 upward. You will notice the person start running temperature, be it adult or a child. They start running temperature, which it's all uncontrollable until you do one or two things. You tap a sponge or you give analgesics to bring them down. Most times they become persistent. The temperature becomes very high that you won't even be able to control it in time. Then you have severe headache. You find out the headache will be so severe. Stiffness of the neck will be so stiff that you won't be able to even turn or rotate it to any side. That is meningitis for you. That is one of the symptoms, the signs of meningitis. And you also have nausea and vomiting. You find out the person is vomiting profusely, frequently, persistently, unstoppable. And at the end, the person gets dehydrated. So you have to go to the hospital. It's not something you treat at home. It's a medical emergency. You don't treat meningitis at home because it's infectious too. You can get infected with meningitis. You find out the person become confused. The person will be irritable, especially in children. They will be so irritated. Any slight touch, anything you do to them, they will be so irritated. There will be this irritable cry. And they also react. There is irritability. They also react to light. They are so sensitive to light that they can't, once you put on light, they react to it. Those are the signs and the symptoms. Then there's sleeplessness. The person will not be able to sleep well. The person will be having sleepless nights because of the headache, the pains. The person become confused. The necks are stiff. You can't turn it to any side. Even some part of the body too will be will be unmovable, so you rush to the hospital. It's not something you can treat, and when the person gets to the hospital, you find out we isolate them. We know what and what to do when it gets to the hospital level. But for you, seeing meningitis for the first time, please, is something that you have to handle with care. It's an emergency. You need to rush that person to the hospital. It's not something you will just keep at home and be nursing, because it's infectious too. We isolate them in the hospital and we take care of them. We do all our, we make use of all our protective measure and all the isolation techniques in the hospital. But for a layman, when you see someone that has a meningitis, please don't keep the person at home, because we are moving into that season that meningitis will be very, very rampant. So please, make sure you air your room, open your windows, make sure you don't lock yourself inside heat, make sure you don't cover yourself with too much clothes. Endeavor to make your room air free, make the ventilation very okay. Then at the end of the day, you find out there are some medications too they use when they get to the hospital. They treat according to symptoms. That's according to the cause. What is the cause? They treat, if it's viral, if it's virus that cause it, they treat it with antiviral. If it's a bacteria, they treat with a antibacterial. They treat with also antifungal if the meningitis is being caused by fungi. So we have a lot of things they also do. Sometimes they may go unconscious, so we put them in the ICU. We also treat them in the ICU too. So we have a lot of supportive treatments we give. They bring down the temperature. They ensure the temperature is well regulated so that the patient won't have any brain damage due to high temperature, or go unconscious, or go into coma. So we make sure we bring down the temperature. You give analgesic, we give antibiotics, we just treat according to the cause. So to prevent all this, please be well enlightened that once it's time, they will announce and you go and take the vaccine. We have meningitis vaccine. Ensure your children take their vaccines. Don't let them skip any of their vaccines. Very, very important, please. Don't let your children skip their vaccines. During the age they are supposed to take, please take them. And we also have booster dose too that you take after some years too. At once you are a year old, they give you a meningitis vaccine. So please try and take care of yourself. Don't go down with a meningitis. It can kill. One of the complications is death if not properly handled and treated. So please endeavor to go to the hospital, take care of yourself, take care of your children, ensure your environment is neat, ensure everywhere is tidy. Please take care of your children. We are going into the dry season where the weather will be very hot. Endeavor to rehydrate yourself. Take care of yourself. Be a good ambassador of your neighbor. Make sure you educate them, tell them to do the right thing. At Nostella's Corner, we will always tell you to do the right thing, because your health remains your wealth. Don't joke with your health. Have a wonderful day.